in the past 250 years, which were the primary respiratory transmitted pandemics. As you may know, of course, HIV/AIDS was in itself a pandemic, but largely transmitted sexually or through blood products. In terms of influenza pandemics, they had a classic kind of first and second wave, where with the first wave of cases in many parts of the world, without any human interventions, nothing that we did, that wave disappeared. It just went away. And then it would go hit a trough of several months potentially, and then come back. And usually the second wave was more severe, lasting for 4 or 5 months after having been absent for several months. With this coronavirus, it's really very different. I don't think there are waves at all. People may talk about waves, but what really it's all about, it's more like a coronavirus forest fire that just keeps burning and burning. And if we suppress it through either distancing or other recommendations, masking and so forth, you can slow it down. And in some cases, if you slow it down enough, you can almost stop it. That's what the Asian countries have done. That's what the European countries did for several months this summer. But that as soon as you let your foot off the brake, just like if you don't finally put a forest fire out and there's still embers burning there, they'll come back. And when they come back, they can burn just as hot and as effectively as they did before. And I think that's what we're seeing now. It's not really a second wave, but where it's being suppressed, such as in Asia, we're seeing very little activity. Where the brake has been let up quickly and without regard to really understanding what that means, you're seeing big increases in cases. Then there's some places like the United States where we let up basically last May, and we've continued to see a great deal of activity, orders of magnitude higher than we're seeing in Europe. People often talk about a second wave, but it never really was. It's an ongoing burning of a forest fire. And if you suppress it, put it out without completely extinguishing it, meaning you just limit its transmission, you hold it to a very small area, you can go for weeks to months and not see it reignite. But it will likely reignite over time. And then you see what's happening exactly in Europe right now, the kind of transmission that's occurring. That's what will continue to happen with this pandemic virus around the world. It'll keep coming back until it burns all the human wood it can find, which is all of us. The only hope that we have really is a vaccine that will get us that kind of protection without having to experience natural disease. Well, they have a great deal more authoritarian control over their populations. The populations are much more willing to adhere to distancing requirements. People will stay indoors. They will keep from socializing together, while people may experience pandemic fatigue, being tired of these requirements. In many of these countries in Asia, they're much more compliant with doing it. And so I think that's the difference. Even in the state of New York here in the United States, they've done quite well since they had their major problem in April where it was a house on fire. And if you look from April until literally mid-September, they too kept their numbers down very, very low by having this kind of very careful surveillance, looking for cases, looking at all the test positivity rates in various zip codes, not just in neighborhoods. And with that, they were able to quickly jump on any emerging infection transmission problems. Now, today we have some in New York City itself, primarily in the conservative Jewish community. And I think at this point, it's going to be a challenge to have them comply with distancing and shutdowns and so forth. And if they don't, then New York's going to see the problem expand. If they do, then they will be much more like the Asian countries and holding the number of new cases down. We have a real challenge in what we call the anti-science movement. People, whether it's about climate change, whether it's about COVID-19, any number of different issues where people challenge the validity of science. The anti-vaccine community is growing around the world. These are people who do not believe that vaccines are safe or effective, nor should they be used. There are those, however, also who are what I would call vaccine concerned. And what I mean by that are there are people who are legitimately concerned that these vaccines for COVID-19 are being rushed, that they're not having adequate safety requirements put in place to understand how safe they are, and that's a group that we owe our very best science to show them what do we know about how well they work and how safe they are. And then I believe most people will take the vaccine. There's nothing more motivating to someone to be vaccinated than to have a loved one die from this disease. And we're going to see more and more families in this world affected by this virus where a loved one will die. And I find that, a terribly tragic and sad reason to get vaccinated. We'd hope we could vaccinate most people before that ever happens, but that will happen with increasing frequency. It's all of us. We're all part of a team here. We're all about team human, and we're taking on team virus. And our job is to basically just get the information out, as technically correct as possible and in a way that's understood by the public, and trust. I mean, at this point, I realize there's not a lot of trust in this world in a lot of different ways. But if there was ever a time of humans versus a virus, this is when we also need to be able to trust. And so we as scientists owe the world our very best science truthfully and completely laid out, and let them see the information. I know that I personally will be right in line when it's my turn to get a vaccine, when I know that they're safe and effective. And so I think you're going to see many scientists who will be in the same boat. Now, I don't want to be at the front of the line because there are other people who are at higher risk than me who deserve that vaccine before I do. Healthcare workers, people with underlying health conditions. But when it's my turn, I don't want to be a second late to get that vaccine.